Good afternoon, everyone. Thank you for joining us. This is like a reunion of former House members here, but I'm joined by several of my Senate colleagues, all of whom served with each other in the House of Representatives. And basically what we wanted to talk a little bit today about is the importance of the vote in the House of Representatives on the health care bill. There's been a lot of discussion around here about how reconciliation can be used to correct or cure some of the problems that members of the House may have with the Senate-passed bill. But I think the message is very clear out of all this is that if you vote for the Senate-passed bill in the House, you own the Senate-passed bill. That is the vote that matters. And any suggestion that reconciliation can correct those things is assuming a tremendous leap of faith that the Senate is going to follow through and enact those. And we have a letter that's been signed by all 41 Republicans in the Senate that is basically stating that our intention when reconciliation, if reconciliation gets to the Senate, that we will oppose points of order or will enforce points of order that are raised against the use of reconciliation for health care reform. So it's we think that the members of the House of Representatives, the Democrats who perhaps voted for this last time would like to vote differently. Those who voted against it last time are being asked to flip their votes. Better think long and hard. If they don't like what is in the Senate-passed bill, if the Senate-passed bill is passed by the House of Representatives and they vote for it, they own that, because it's, in our view, very unlikely that any reconciliation vehicle is going to stay intact and going to be able to include all the things and all the fixes that they assume will be in it. And those of us who've served in the House know full well, too, that when you are told to trust the Senate, or don't worry, we'll fix it in conference, those are promises we've all heard before. And believe me, we've learned the hard way, I think, on many occasions, not to believe those sorts of promises. And so that's the message we want to convey. And I want to ask my colleagues, I'll ask Jim DeMint and then Roger Wicker and then Tom Coburn to close it. So.
Well, thank you. Thanks, John. All of us in the House, as John says, just have to smile when we're told that vote for this bill even though you don't like it, and they're going to fix it later. I had the experience during the No Child Left Behind debate when President Bush was in the White House and the Republicans had a majority in both houses, when I was opposing the bill, and President Bush brought me down to his office, reminiscent of what I see happening now. I had a provision that was real important to me. We call it state flexibility, that the states could opt out. And the president said, Jim, it'll bring the bill down if you put that amendment in the House. But if you will support the bill without it, I will fix it later. Trust me. It has still not been fixed. And it won't be this time either. We've got a lot of good friends who are Democrats in the House. They know better. If they pass the Senate bill will become law. We have 41 firm votes on all the procedural motions, which require 60 votes in the Senate. So no House member can say that they're voting for a bill that will be changed later, because it will not. We're here to guarantee it.
Thank you very much. I want to make 3 points, one political, one procedural, and one substantive. Tom Coburn and I Tom Coburn and I were elected in 1994. This huge shift occurred that year. And it was in large part because Democrats in the House of Representatives took an unpopular vote on the tax bill, a vote that their constituents back home didn't want to. And they took it as a result of arm twisting and persuasion by their leadership. They paid the price at the polls. Now, the people of the United States don't want this health care bill. They don't want the House version. They don't want the Senate version with all of its special deals and tax increases. Our brothers and sisters in the House of Representatives who defy public opinion in voting for this bill will, I think, suffer the same, or at least risk suffering the same political defeat that many of their predecessors did in 1994 when Tom and I were first elected as part of the first majority of Republicans in 40 years. That's the political point. The procedural point is to reiterate what the two folks before me said. 41 of us have signed a letter. It is in writing. None of us will vote to waive points of order should we get to the reconciliation process. So I would say this to my colleagues on the House side. If they are being told that there are items in some sort of a cleanup reconciliation bill, they need to check with their parliamentarians, both in the House and Senate, and see if they require a waiver, a budget waiver, a Byrd rule waiver. There will be many provisions, if this scheme unfolds, that will have to have points of order waived. Those points of order will not be waived because there are 41 solid Republican votes against that. So check it out with the parliamentarians, and don't believe everything you're told. And then the substantive point about the substantive law. Even if the Democrats in the House and Senate are successful beyond their wildest imaginations in getting all of these shenanigans through, they're going to wind up with a bill that cuts Medicare by $1.5 trillion and foists a huge tax increase in the form of a Medicaid mandate off to the states. I can assure you that will be the primary issue between now and November. So I would urge my colleagues in the House to listen to the people and do the political thing, but for heaven's sake, do the right thing. Don't cut Medicare. Don't do an unfunded mandate to the states.
I'd make just one point. Under the Budget Reconciliation Act, reconciliation only applies to law. So this idea that they can deem something as passed in the House, there can be no reconciliation unless there's already a law, which means the president will have to sign the bill for reconciliation to apply to the Senate health care bill. So the story that is being said in the House, don't worry, you can vote for a rule, a self-enacting rule, deeming something passed. It doesn't pass what the law says, and the budget chairman also mentioned that today in some of his comments. So the very fact that we won't have reconciliation unless the Senate bill is already signed into law. And if it is, what is the motivation for the Senate to change anything, since it's the Senate bill? So consequently, they're playing with fire, and the plan they have today will not work, so the bill will have to be signed into law before any reconciliation can be applied to it. With that, we'll take any questions that you might have.
Could you talk a little bit about, it sounds like there's some growing momentum within the Democratic caucus to look at filibuster reform, which is a process they might need to land in the future. Could you talk a little bit about what it would do to the Republican caucus, how y'all, if you view this as a real possibility?
Well, I think you need to go back in history. When the Senate was first formed, there was no limitation on debate, period. You couldn't cut off debate. There was no mechanism to do it. And then it went to 67, and then it went to 60. It started in 1916 when we got back to 67. What that's saying is we don't agree with the founders that the Senate ought to be different than the House, and that the rights of the minority should always be protected. And I can't tell you how many Democratic leaders, including our present majority leader, has said it's tyranny if you get rid of the 60-vote rule. The idea of the Senate being a place where we have to form consensus to make major changes in this country should not be put off lightly. The fact is that's what's best for the country. It works well because we are the saucer that cools everything off. And the dangerous thing about health care, everybody in America wants us to make major reforms in health care. But when we do it in a way that does not build consensus, you see what's happening today. What is most important is not what's happening here, it's what's happening out and across the country. And if they're perceiving that they can change the function of the Senate towards simple majority rule, Americans aren't going to buy that either. Go ahead.
Yes. Can you tell us where the debate over the abortion language, what role it's playing in this process as far as the House voting for the Senate bill?
Well, first of all, I would remind you that when abortion has been considered in reconciliation, 1995 is thrown out. The rules, and hopefully the parliamentarian will follow precedent, is that if it's strictly policy and not tax related or spending related, and it's there to adjust policy, it falls by the bird rule. It becomes bird droppings. And that is what I would expect would happen. But if it didn't, just remember, there's no pro-life majority in the U.S. Senate. So it's highly unlikely that the 51 votes could be there to pass a Stupak fix for the Senate bill. And matter of fact, it won't happen because pro-life members like me, I won't vote for it. So you have a large number of pro-life members who will never vote for it.
And if they're being told by their by anybody in their leadership that they're going to fix this in reconciliation in the House, it is a pig in a poke. I mean, there is no way that this can be modified or adjusted through reconciliation. And those Democrats, pro-life Democrats, who have held the line in support of the Stupak language, assuming that reconciliation can correct that, are being, promised something that they can't deliver on. And so I think that if that is the issue that matters to you, and you're a House Democrat, then you better think long and hard, because that's not going to be the pro-life vote.
Yes. Essentially what you're saying is that you'll vote against your conscience on the abortion issue?
No, because by voting that way, what you do is if it fails, then you keep the Hyde language, which is actually a pro-life vote.
But you'd be voting with Barbara Boxer on an abortion?
Yeah, I would. Certainly would.
Yes.
There seems to be a real effort this week for the Dems to go after the insurance companies. There was president on Monday, and then protesters yesterday. Can you just describe this tactic? And is it helpful? Is it hurting negotiations? Where do you see this? How do you describe this tactic that they seem to be using this week?
Well, I think they're trying to distract from the substance of the bill. And, it's easy to pick a symbol that everybody doesn't like, in this case the insurance companies, and attack the insurance companies because they don't want to have to defend the substance of their bill. Their bill, again, as my colleague from Mississippi noted, hasn't changed. It hasn't changed the entire course of this process. It has all the same core elements and components, and that's higher taxes, that's Medicare cuts, and for most Americans, higher premiums.
Let me add to that, is that their bill, the Senate bill, puts 15 million Americans in those insurance plans. Now, there's a little bit of irony there. You're going to beat up the very people that you're going to put, 15 million are going to go into Medicaid, and 15 million are going to go into insurance plans, the very people they say are so terrible.
Let me make a point here, because the hypocrisy here gets old. It's not only a distraction from the substance of the bill to go after these insurance companies, but it's hypocritical. Two provisions by the Republicans that the insurance companies were most opposed to are interstate competition and small business health plans. Both of those would force competition onto these insurance companies. It would allow small employers to self-fund like larger do under the ERISA plans. But in all cases, the Democrats oppose these. So the president opposed them as well and voted against them in the Senate. So the fact is, it's the Democrats who have kept competition from happening in the private insurance sector, and now they're lambasting them, and it's very, very hypocritical.
Do senators see a potential legal issue over that question of the president having to sign the underlying bill before reconciliation would be signed? In other words, if the Democrats see that differently, do you see this going outside?
I see a court case being filed immediately if, in fact, that happens. The law is very clear. Reconciliation is based on law. If a bill has not passed, not been signed into law, it is not law. You cannot reconcile something that is not law.
If the Democrats are able to get the healthcare legislation through, to what extent do you see repealing it as the agenda for Republicans going forward? If you're so confident that you'll get one or both chambers back, is that enough of an agenda? Or
Well,
what is the Republican?
I think the agenda it's going to be shaped more by the American people, and I think you're going to see all kinds of activity at the grassroots level to make I will say, I'm not going to concede it, but assuming that it did pass for just a moment, hypothetically, I think you're going to see that legislation become the issue in the 2010 November elections, and I think it will be a referendum on that, and I think you will see an immediate effort to repeal it. And I think a lot of candidates who are running, especially if you voted for it, are going to be defined by that vote. And so I think that would be an immediate consequence if this thing were to pass.
If I could interject there, and I do think this would be driven by public opinion. But the point to take away from what Senator Thune just said is that Democrats in the House shouldn't think that they can vote for this bill before the Easter recess and put it behind them. It will be the paramount issue. If they pass it, it will be the paramount issue that will see a lot of them going home for good after the November elections.
Thank you.
Thank you.
Thanks, everybody.